On the top part of this chest, you'll notice the Hickman catheter in place. Here's the port needle that we just did, and this is going to be our Hickman now. First thing you're going to do is prepare your equipment as we showed you before. To be ready to go, one thing that I always do is prepare my cap and my tubing for flushing. So everything here is sterile. I can remove my cap, touch this, sterile to sterile, connect, then take the end of my cap and attach it to my extension set. Everything has been done sterile to sterile. Flush it, set it down, and we're ready to go. So I will don my mask prior to removing the old dressing. I have prepared my equipment, gelled my hands, and donned my gloves. These are clean gloves. So I'm going to put my mask on and prepare to take this dressing off. One thing you might want to do prior to removing your dressing is to secure your catheter, because this person happens to be lying down, but sometimes they're sitting up, and you don't want this to dangle out of control. So I always throw a piece of tape somewhere to keep it from dangling and, contaminating its end. So I'm going to go ahead and start to remove this dressing. If you take your tegaderm and lift, what I'm removing is actually a tegaderm dressing as opposed to the opsite dressing, which you'll see down here. The opsite dressing has the little orange stripes on the side and a little different adhesive. So as I'm moving this along, I can secure my catheter. And as I pull up, it lifts away from the skin. Instead of going too quickly, lift it up one step at a time and remove it. So now that I've removed my old dressing, I can discard my gloves, gel my hands again, and don my sterile gloves. Now that I've donned my sterile gloves, I can access, of course, to handle anything within my sterile kit. I'm going to remove my sterile field and lie it below the area that I'm working in, keeping my hands clean, of course, and not contaminated. So, I've got my insertion site exposed. You always examine your insertion site very well. Look for any redness, any swelling, any drainage whatsoever. Occasionally you'll see a little development of things around there, but that's pretty typical. And once you clean it off with the dressing, it will hopefully be nothing to be concerned with. Of course, any drainage needs to be addressed. And as you'll see, I've got my ChloraPrep that I squeezed and prepared to go. And I will scrub-a-dub this thing for 20 seconds. Back and forth, back and forth, back and forth. Actually, there's an insert in here that tells you all about ChloraPrep, and it's a good thing to read. So, 20 seconds, and let it dry normally. I always set this down on my sterile field, and while I'm waiting for this to dry, I'll take a piece of gauze that I have, and I'll lay it gently over the insertion site, which just protects it a little more. I've got the extra gauze. I feel it's a good use for it, because most of the time you don't need it when you're just doing a simple dressing change. Now you want to make it's completely dry. Make sure it's completely dry before you put your new dressing on. The reason for that is that the ChloraPrep tends to irritate the skin a little more than your old-fashioned, your old betadine and alcohol if an adhesive dressing is put over it. So once it's very dry, you can remove your gauze. This again has an opsite dressing. You want to center your insertion site under your dressing so you can move your catheter and center this down. And work your way outward. You don't want to stretch it too much, but you want to get everything under there as secure as possible. Again, you can remove your orange tapes. And as you will notice, this is completely free of any gauze, any tape, anything else. I believe that less is more when it comes to dressings. You don't need anything else under there. This is the best way to be able to visualize your insertion site, assess it, and monitor what's going on with it. If patients don't like to see that, whether it's on their PICC line or on their chest, you can always cover it with something later. But underneath the dressing, less is more. If you happen to have a stat lock in place, which is mostly used with PICC lines, that should also be outside the sterile dressing unless you have another one to place. Please do not cover up a stat lock again with a sterile dressing. So that's your Hickman dressing change. Now that I've completed the dressing change, I'm going to put an extension set on and a new cap, which we do weekly. If you remember, I prepared my cap and extension set with a saline flush. I'm going to get my alcohol swab, clamp this. Of course, I'm still wearing my mask anytime you take a cap off. Remove the cap, clean this with alcohol, attach your extension set, and go ahead and flush. Once you flush with saline, you'll follow that with heparin. Prepare your heparin syringe by pulling back a little bit to get rid of that little bubble. And push upward. Again, clean it with alcohol. Attach your heparin syringe and flush. The last thing you'll do is remove your syringe and clamp your catheter. This can be secured in whatever way the client finds comfortable. Very often on a Hickman catheter you won't need an extension set, but I just put it on there as an example of how you would do it and you're maintaining a nice, clean, sterile environment. And there's your Hickman dressing change.